I am Dr. Claire Vega, and I need you to put your blood pressure pill down for exactly 13 minutes. Just set it on the counter. Do not throw it away, just set it down. Because what I am about to show you in the next 13 minutes will change the way you think about that pill forever. You take it every morning. You have taken it for years. Your doctor told you it would protect your heart. They told you it would save your life. They never told you about the emergency brake built directly inside your own chest. They hid it from you deliberately. There is a way to drop your blood pressure 20 points in under 2 minutes. It requires 0 pills. It costs you absolutely nothing. And the pharmaceutical companies funding your doctor's medical conferences are absolutely terrified of what I am about to teach you. They cannot patent the air you breathe. They cannot bill your insurance company for oxygen. Today, I am exposing 3 exact breathing techniques they intentionally kept from you. These techniques override the chemical stress strangling your heart right now, naturally, immediately, without a single side effect. Get a pen, write your current blood pressure number down before we begin. You are going to need that number in about 12 minutes. Let me first explain what is actually happening inside your chest. Your doctor tells you your nervous system is simply broken from old age. That is a profitable lie. Here is the biological truth they never explain. When you breathe fast and shallow, the way anxious, stressed people breathe all day, your body floods itself with cortisol and adrenaline. These are your emergency stress hormones. They were designed for running from predators, not for sitting in an armchair watching the evening news. Those stress hormones do one thing to your blood vessels. They squeeze them shut violently. Your heart has to pump harder to force blood through narrowed pipes. Your pressure spikes. The pills your doctor prescribes force those vessels back open chemically. They work by overpowering your own biology with synthetic compounds. But you can open those same vessels naturally. You can command your own nervous system to stand down. You have always had this power. They just never handed you the instruction manual. Today, I am handing it to you directly. Technique number 1. The 4-7-8 override. This is your daily weapon. This is what you use every single morning before you ever touch that pill bottle. The 4-7-8 override forces your resting nervous system to activate. It physically widens your blood vessels. It dumps toxic stress hormones out of your bloodstream in real time. Here is exactly how it works. You breathe in through your nose for 4 seconds. You hold that breath deep in your lungs for 7 seconds. Then you blow every bit of air out through your mouth for 8 seconds. That long 8-second exhale is the critical part. That extended exhale is what activates your vagus nerve. Your vagus nerve is the master-off switch for your entire stress response. The pharmaceutical industry has spent decades trying to replicate what that nerve does naturally. They cannot, because they cannot patent your own biology. Let me tell you about James. James is 72 years old. He spent 35 years working in a steel mill. Loud, hot, physically brutal work. His blood pressure had been climbing for 15 years. His doctor kept adding medications. First 1 pill, then 2. Then the doctor wanted to add a 3rd. James came to me with a pressure reading of 165/98. His hands were shaking when he sat down. I did not hand him a prescription. I taught him this exact technique. Within 2 minutes, his pressure dropped 25 points. His doctor called it a fluke. He told James the medications must finally be working properly. James looked him straight in the eye and said nothing. He knew the truth. He had taken back what the system spent years convincing him he had lost. Now we are doing this together, right now, in your chair. Sit up straight. Put one hand flat on your stomach. You need to feel your belly expand, not your chest, your belly. That is how you know you are breathing correctly. Empty your lungs completely first. Blow everything out. Now breathe in through your nose. 1, 2, 3, 4. Hold it. 1, 2, 3, 4, 5, 6, 7. Blow it out slowly through your mouth. 1, 2, 3, 4, 5, 6, 7, 8. Again. Breathe in. 1, 2, 3, 4. Hold. 1, 2, 3, 4, 5, 6, 7. Exhale completely. 1, 2, 3, 4, 5, 6, 7, 8. One more cycle. Breathe in deeply. 1, 2, 3, 4. Hold it right there. 1, 2, 3, 4, 5, 6, 7. Push every bit of air out. 1, 2, 3, 4, 5, 6, 7, 8. Feel that. Your shoulders just dropped, your jaw unclenched, your heart rate slowed down. You just did in 90 seconds what their pill takes an hour to accomplish. Do this 4 times every single morning. Do it before bed every night. You are retraining your nervous system to stop treating normal life like an emergency. The industry built their entire profit model on your body, staying in a permanent state of crisis. You are dismantling that model one breath at a time. Technique number 2, resonant breathing. This one is invisible. Nobody around you will ever know you are doing it. You breathe in for 5 seconds. You breathe out for 5 seconds. No holding, just a smooth, continuous, quiet rhythm, 6 complete breaths per minute. 6 breaths per minute is the exact biological frequency that synchronizes your heart and your lungs. When they synchronize, your blood pressure regulation system resets completely. Your heart rate variability improves. Your vessels relax. Let me tell you about Barbara. Barbara is 76 years old. She had what doctors call white coat syndrome. Every single time she walked into a medical office, her pressure skyrocketed from anxiety. 170/100 every appointment, without fail. Her doctors used those readings to justify heavy medication. They used her natural fear of medical offices as a billing opportunity. She was not sick. She was scared, and the system profited from that fear every single month. I taught Barbara resonant breathing. I told her to start the moment she sat in the waiting room chair. Before they even called her name, her next appointment, her pressure read 118/74. The doctor stared at the cuff. He checked it twice. He asked the nurse to recheck it. He took the credit for the medications finally working. Barbara smiled and said nothing. She knew exactly what she had done. She had beaten a rigged game using nothing but the air in the room. Let us practice this together now. Hands on your belly. Breathe in smoothly. 1, 2, 3, 4, 5. Breathe out gently. 1, 2, 3, 4, 5. Keep going. In 1, 2, 3, 4, 5. Out 1, 2, 3, 4, 5. You are actively starving the pharmaceutical companies right now. In 1, 2, 3, 4, 5. Out 1, 2, 3, 4, 5. Feel your heartbeat slowing. Feel the tightness leaving your chest. In 1, 2, 3, 4, 5. Out 1, 2, 3, 4, 5. Practice this for 10 minutes every single evening. Within 3 weeks, your baseline blood pressure drops measurably. Your doctor will stare at your chart in confusion. They will assume the medications are finally working. You will know the real reason, and you will never need to explain it to them. Technique number 3, alternate nostril breathing, your emergency brake. Use this one when the spike hits without warning. 2 in the morning, chest tight, heart pounding. The kind of moment they charge you $4,000 to sit in an emergency room and experience. Let me tell you about Robert. Robert is 68 years old. His pressure spiked in the middle of the night for 3 consecutive years, 180/110. He would wake up in a cold sweat, call an ambulance, and spend 6 hours in an emergency bay while the hospital billed his insurance company for doing essentially nothing but watching him calm down on his own. I taught Robert this technique. The next time he woke up spiking, he sat up in bed and used it immediately. His pressure dropped 30 points in 5 minutes. He never called that ambulance again. He stopped being their most reliable source of middle-of-the-night revenue. Here is exactly how you do it. Sit up straight. Raise your right hand to your face. Your right thumb closes your right nostril. Your right ring finger closes your left nostril. Close your right nostril with your thumb now. Breathe in slowly through your left nostril. 1, 2, 3, 4. Now close your left nostril with your ring finger. Release your thumb. Breathe out through your right nostril. 1, 2, 3, 4. Keep your hand there. Breathe in through your right nostril. 1, 2, 3, 4. Close your right nostril. Open your left. Breathe out through your left. 1, 2, 3, 4. That is 1 complete cycle. Again, close the right. Inhale left. 1, 2, 3, 4. Close the left. Exhale right. 1, 2, 3, 4. Inhale right. 1, 2, 3, 4. Close right. Exhale left. 1, 2, 3, 4. Drop your hand. Breathe normally. Feel that stillness in your chest. That is your emergency brake. It is always with you. It costs nothing. It cannot be taken away. It cannot be discontinued when your insurance changes. It cannot be recalled by the manufacturer. Here is your permanent protocol starting tonight. 4-7-8 breathing every morning before you get out of bed. 4 full cycles. Resonant breathing every evening for 10 minutes. Alternate nostril breathing the moment any spike hits, before you reach for the phone to call anyone. Now pick up the pen. Check your blood pressure right now. Compare it to the number you wrote down at the beginning of this video. That difference is the truth they hid from you. Your body is not broken. It never was. They needed you to believe it was broken. A broken patient fills a prescription every 30 days for the rest of their life. An empowered patient is their worst financial nightmare. You are not their patient anymore. You are in control of your own chest. I am Dr. Claire Vega. I am exposing everything they buried. Hit subscribe right now, because my next video exposes the specific statin drug millions of men your age are taking every night that is silently destroying your liver. Your doctor sees the warning signs on your blood panel. They say nothing, because stopping that prescription costs the pharmaceutical company $12 billion a year. You need to know which drug it is before your next appointment. I am Dr. Claire Vega. See you in the next video.